and my medication is wicked expensive. A single dose is over $13,000. And in this video, I'm going to reveal how I get my monthly meds absolutely free. Now, I've been on this for years, and I've literally never paid a penny for it. I have a ton of resources and ideas for you today. There are over 10 different options in this video, but not every option will work for every person, so be sure to stick around even if one or two of these don't apply to you. All right, first, let's kick off our list with the powerful resource that has provided essential healthcare support to millions of low-income Americans: Medicaid. If you or someone you know is struggling to afford prescription meds, Medicaid might be the answer you've been looking for. This program provides free health coverage to eligible low-income Americans who can't otherwise afford it. In addition to help with your medications, Medicaid can also cover doctor's visits, hospital stays, lab tests, preventative care, mental health services, and even vision and dental in some states. When we were younger, my husband actually had extensive dental work done that was entirely covered by Medicaid in Washington state, and that was a lifesaver for us. The eligibility requirements do vary a bit between states, but generally Medicaid is available to low-income individuals, families, children, pregnant women, elderly adults, and people with disabilities who meet the income guidelines. To apply, you just need to fill out an application with the same government office that handles food stamps and other welfare benefits. And if you think you can't get Medicaid because you've been denied before or because your state hasn't been helpful in the past, it's time to try again. The rules have changed drastically over the last few years, and even states that were refusing to expand Medicaid are making important changes. For example, Georgia's new Pathways to Coverage program expands Medicaid-style coverage to more than 60,000 more low-income people in the state. If Medicaid doesn't work for you, or if you need a medication that Medicaid won't cover, don't lose hope. There are a ton of other ways that you can get assistance, including patient assistance programs. These programs are offered directly by the pharmaceutical companies themselves and can drastically reduce the cost of your medications. Remember that $13,000 a month medication that I'm on? It costs less than $25 a month if you qualify for their patient assistance program. And sometimes you can even get it free through that program. That being said, of course, I don't qualify, so that's not the option I use to get my meds for free, but I'll talk more about that later. In the meantime, there are a lot of perks to using a PAP program. In addition to getting free or heavily discounted medications, these programs usually provide ongoing support and convenient delivery options to make your life easier. Every pharmaceutical company sets their own eligibility criteria for these programs, so they will vary depending on what medication you're on. Generally, you do need to have a valid prescription from your provider, of course, and meet specific income criteria. Typically, you cannot use these discounts if you're covered by any form of government insurance, including Medicare, Medicaid, or CHAMP VA. Some of these programs will require you to have no insurance at all before they will let you qualify. It just depends on who makes those meds. And it's important to note that we're talking about contacting the maker of the medication themselves, not your local pharmacy. For example, Viatris makes many different medications and offers their medicines free to patients who can prove they have a financial need. Teva also provides certain medications for free through their patient assistance program. Eli Lilly also offers free medications through the Lilly Cares Foundation. This is actually a very common thing for prescription manufacturers to do, so I highly recommend looking into this first if you need help. In some cases, you may actually save money by asking your doctor to switch you to a name brand medication with a patient assistance program. How weird is that? Now, speaking of doctors, some providers can help you save money on your medications automatically. You can check with the free clinics in your area to see if they have an on-site pharmacy. If you aren't aware of which ones are in your area, we have a list at lowincomerelief.com/free-clinics. And if you don't see your area listed there, let me know and we'll do some additional research. And if that doesn't work for you, this next trick definitely will. Literally anyone can use a prescription discount card, whether you're low income or not, insured or not, it literally does not matter. Anyone can use these to save money on their meds. You just need to claim your free card and show it at the pharmacy register to get your discount. It is not the same thing as insurance, but it does help lower your prescription prices. Picking up a card only takes a few moments, and it can make a huge difference in the amount of money that you pay. A few years ago, when the VA didn't refill my husband's medications in time, we were told that we would need to pick up about 6 pills at our local pharmacy to tide him over until that next delivery came. We were shocked when we got there because we found out that those 6 pills were going to cost $80 each. Fortunately for us, the pharmacist recommended that we try a prescription discount card. We picked one up, and when we went back to the counter, that same bottle of medication was only going to cost us $6. $6 instead of $480. Isn't that insane? Now, there are all different types of prescription discount cards out there. Some will help you save 60%, 70%, 80% on your meds. In my experience, Lower My RX offers one of the highest discounts available. So they offer up to 80% off of your prescription prices, and you can grab your card right now for free using the affiliate link below. It only takes a few minutes and it can help you save a ton. Now, if you're covered by Medicare, make sure you look into the Extra Help program as well. Extra Help is a federal program that provides additional assistance with your monthly medication costs, as well as your monthly premium, annual deductible, and more. You have to meet income limits and asset limits in order to enroll in Extra Help, but if you qualify, you can pay as low as $4 for generic meds and around $10 for brand name medications. Once your total medication costs for the year exceed a certain amount, anything extra will be fully covered. And if you live in a nursing home or get home or community services, you won't have to pay anything for your medications at all. Now, some people are automatically enrolled in Extra Help, especially if they already receive SSI, but often you have to apply for it on your own. If you're interested, you can apply on the Social Security website at ssa.gov. If you're getting a discount but still can't cover the cost of your meds, don't worry. There are many nonprofits, churches, charities, and organizations that can help you pay for your medications. However, these sources are often very strained because a lot of people need this help. So using a tool like a prescription discount card can make it easier for these agencies to help more people with the funds that they have available. So if you get a discount but you still need help with the cost that remains, make sure you check out these organizations for help. You can often get help with meds from St. Vincent de Paul, although the amount that they pay is usually very limited. Catholic Charities, Lutheran Social Services, Jewish Federation of North America, and the United Way may also help with medications as well. Some states have funds available at the county or township level that can assist you with this. You can always call 211 or 311 if you're in New York City to find other nonprofits in your area that may be able to help with medicine. If you need help getting a medication that's new to you, there's another trick that may be able to help. Your medical provider may be able to provide you with a sample dose. After all, pharmaceutical representatives often leave samples with doctors in the hopes that the doctors will promote or sell that medication. Now, it can take a little while to get on a patient assistance program or get financial help from a nonprofit, so a free sample dose can help you get started with your medication while you look for other resources. You just need to ask your doctor and see what they can do. Incidentally, this is how I got started with my medication. The doctor gave me a sample dose, and that gave me time to figure out how to keep getting that medication for free. And I tell you, having my symptoms ease up made it a lot easier to think through. So now let's talk about how I get my medications for free every month. After I got my first free sample dose, my symptoms were completely wiped out and I was amazed. It made it so much easier to be able to think through the things that I needed to do to make this work, because my insurance refused to fill it. I use Chant VA, which is for dependents of disabled veterans, and part of my coverage does include free medication through Meds by Mail, but since my prescription was only available through a specialty pharmacy, they wouldn't fill it. I was so frustrated and angry, and for almost a year, I was in absolute agony while my condition got worse and worse. I couldn't move without pain, and it was awful. Finally, in my desperation, I started calling around for help, and I was connected with a really helpful lady. She told me that the only reason my medication had been denied was because my doctor had prescribed the Easy Injector pen, and the Meds by Mail pharmacy wouldn't supply that, but they did have the same medication if I was willing to use a needle and syringe. They just needed my provider to alter that prescription. She also told me that if I really wanted to use the Easy Injector, my provider could prescribe me a nearly identical medication that the pharmacy did cover, but in all of my calling up until that point, no one had bothered to mention that to me. So I was really grateful for that insight, but I was also honestly kind of pissed because I spent a year in agony because nobody thought to mention that a slight tweak to my prescription would result in full coverage. Once I learned that, I immediately called the doctor's office and left a message. The doctor tweaked my prescription, and I've been getting my medication for free for the last 3 years. It's been life-changing. So all of this to say, don't give up. Ask a lot of questions. Push back. Ask your doctor to tweak your medications. Ask what other things you can take. Talk to the insurance company yourself and ask what they will cover for your condition. Use the pharmacy discount programs we talked about. Find out what the best deals are. I know this isn't easy when you're not feeling well, and sometimes it can feel nearly impossible, but you, my friends, are worth fighting for. And if all else fails, there are still other options that may be able to help you. Your doctor may be able to prescribe you a cheaper generic or a different name brand medication that has a patient assistance program. You can connect with patient advocacy groups. You can start a GoFundMe or reach out to other organizations. And if you're really desperate, you may be able to participate in a clinical trial. You can also watch our other videos on ways that you can get low-income grants, because that money can usually be used to buy medication, and I'll see you there.